This video was requested as an educational resource for the North Carolina Business Committee for Education, or NCBCE. The goal is to share knowledge about science that's related to the COVID-19 pandemic. My name is Dr. Jared Heffron, and I serve as a microbiologist for Novozymes. Personally, I have a background in infectious diseases from my career before Novozymes, and I have experience in teaching that I've been using nearly every day for the past 20 years. Novozymes does not work in this space. However, we want students to get an opportunity to learn from my expertise and build a better understanding of the basics around what is indeed a truly unprecedented situation. Hello and welcome to our fourth presentation in our series about viruses. This series is also going to be heavily influenced by COVID-19, thinking about what's going on with a pandemic and who are the people who are taking care of the issues during a pandemic, and what are the jobs that are involved when a pandemic is going on? What are they doing? How are they doing it? And how did they get to that point where they're able to do those jobs? We'll find out about those things. My name is Jared Heffron. I'm a microbiologist at Novozymes. I have a good bit of experience with a lot of these jobs, and I'm happy to share them. I'm also joined with my favorite guest, my son.
Hi.
And I'm looking forward to see what we talk about here. So in the third presentation we focused specifically on pandemic, COVID-19 pandemic, the keywords around that, what's going on, the concepts. So what are those main concepts? If there's a pandemic going on, tell me what's happening.
There's an infectious disease that's actively spreading everywhere in the world, and people are unfortunately getting sick.
Right. Do you remember the name of the disease or the organism that's causing COVID-19?
SARS-CoV-2.
Good. Yeah. So when this is happening, people are getting sick, right?
Yes.
And when they're sick, where are they going to end up going?
Hospital.
So they go to the hospital. And so there at the hospital, you got doctors, right? Who else is at the hospital helping?
Nurses.
Nurses, that's right. And there's also some other people we'll talk about. So those are jobs that are really important. And then you got scientists like me who, what do we do? We'll find out a little bit about that. But they're trying to figure out what's going on with the disease, right? And maybe they can help invent a therapy. Do you remember a name for any kinds of therapies for these that are?
A vaccine.
Vaccine, yeah, they might help with that. There's other, and there's antivirals, or specifically drugs that stop a virus. And then you got governments. A lot of people, well, actually, I think a lot of people are aware right now with social distancing just how much the government plays a role in our lives and understanding what's going on, right?
Yeah.
Yeah, you're not going to your school building anymore, are you?
No.
And that's because the governor told us that we couldn't.
Sad.
I know. So so government has a big role in all this and what's happening here. So those jobs are really important too. We'll talk more about the science side of those jobs. And then everyday people like you and I, when we're here at home, we've also got to know what's going on and protect ourselves and make good, healthy choices for ourselves and the people that we love so that we can help control the spread of the disease.
Yes.
So there are important jobs regarding communication of that information so that everybody knows, even if you don't have a science background.
Okay.
All right. When I was thinking about these different jobs that have to happen, it fell out, at least in my mind, into these three different categories. You got the jobs dealing directly with people who are sick, the disease management jobs.
Like doctors and nurses and healthcare administration.
Right. And then you got the scientists that are doing all the research. There's lots of different kinds of researchers with different specialties. And here are the ones that you kind of hear the most about right now during a pandemic. The first one is a tough word, right? Epidemiologist. Can you say that?
Epidemiologist.
A couple extra syllables in there. That's okay. And then you've got, these other ones, right?
Virologist, microbiologist, biochemist, and geneticist.
Geneticist. Good job. Yep. So we'll talk about those more specifically. And then you got the communication jobs like
science policy advisor or science writers.
Exactly. So let's start off with disease management. These jobs are at the front lines of the pandemic because these are the jobs that directly work with those that are most impacted, the sick people. All right? These are tough jobs. These are stressful jobs. These are incredibly important jobs for obvious reasons because they're the ones who are really saving people's lives when they are deathly ill. All right? Doctors, nurses, healthcare administration. Doctors and nurses, I got a feeling you probably have a good idea what they're doing.
Yeah.
Doctors are making a lot of decisions. They're deciding whether or not you get a test for whatever it is that needs to happen because they listen to your symptoms. They hear what's going on with your body. They might have records of you from going to the doctor in the past, and they might decide, oh, you should get a COVID-19 test. Or they actually might decide that you shouldn't get one of those tests, and then you should get something else entirely different based off of all that information. So they have to have a really, really broad understanding of all the different medical conditions that are out there, and all the different diseases, and all the different problems people can have, and understand what's the most likely problem here. Because the patient might be completely wrong if they think they know what it is. The doctor's got a lot more experience with understanding what's happening in your body. Also, they got to end up making the choice of when they decide what is wrong with you, when they finally get that test that's positive, that says, okay, this is the problem. Then they got to figure out what the treatment is. Okay?
That's interesting.
So yeah, that the treatment part is actually really complicated as well too. It's another big decision. So you are a healthy 10-year-old boy, right?
Yeah.
Do you take medication for anything?
No.
Do you have any other medical conditions?
Not that I know of yet.
Good. But I don't know of any for you either. So for you, the doctor might see symptoms from you and fully understand what's wrong with you. It might just quite simply be that, yeah, you're sick. You've got a virus or you've got a bacteria, whatever it might be, and then they can make the decision to treat it, and it's pretty straightforward. But there are other people who have other issues, other medical issues that are going to be interfering with the treatment. They might have diabetes. They might have high blood pressure. They might have a long list of other things. The doctor has to understand all those things and what it's doing to that patient's body. And some treatments, some drugs, some medicines don't work well or work correctly if the patient has these other problems. So then the doctor has to understand how all that stuff works together in a human body and come up with the right treatment. So do you think then that the same treatment works for every patient?
No.
No. And so a doctor's got to make these choices for every single patient they see.
Yes.
It is a big, big, big job. And it requires a lot of knowledge to do that correctly.
So it's not as easy as I expected it to be.
Right. When you're a healthy 10-year-old boy, you go in, the doctor's like, oh, how you doing? What you going? Oh, yeah, your heart's still beating, your blood's still pumping, your reflexes still working. Excellent.
How did my heart stop beating?
I know. I hope it doesn't. So that's what it seems like. It's easy when you go in and you're healthy, right?
Yeah.
But when things are going wrong, then there's a whole lot of choices they have to make.
Yeah.
And they're doing that without you necessarily always seeing it. Nurses, though, you see a lot of what nurses are doing, right?
Yeah.
Because they're the ones you interact with a whole lot. If you have to get a test, the nurse is going to give you the test, right?
Yeah.
If you have to get a COVID-19 nasal swab, the nurse is going to be the one with the swab going way up your nostril trying to get that sample.
I would be very uncomfortable.
It is pretty uncomfortable to get a nasal swab. But they're the ones who know how to do it. And they know how to do it correctly. They know how to do it safely so you actually aren't going to get hurt. And they know how to get that sample prepared safely so that it's going to be the best test possible.
Okay.
Right? They have that knowledge. They know how to execute these things correctly. Then when it comes to the treatments, the doctor makes the decision, says this is the kind of test to get. The nurse knows how to give the test. A doctor says this is the treatment we're going to do. The nurse is probably going to be the one who gives that treatment, administers the drug, hooks up the patient to whatever equipment is necessary. The nurse knows how to do that, how to do it correctly to keep themselves safe and to keep the patient safe. They have that knowledge. And then also there's the communication part too. Doctors are often talking to the family members, explaining what's happening, telling them what's going on, especially if the patient is not able to make decisions for themselves very well because of how sick they are. The nurse is going to be communicating a lot with the patient and helping make them feel as comfortable as possible and help explain to them what they are doing so that a patient doesn't freak out, right? Because, I mean, when it's time for you to get a blood draw or a vaccine, the nurse talks to you a lot, right?
I freak out.
And you freak out. Does the nurse try their very best to help calm you down, explain what's going on?
Yeah.
And the nurse usually does an incredibly good job at sticking you even though you don't like it, right?
Yeah.
Can you imagine trying to do that all day long on people who don't want to get stuck?
Ugh.
Yeah.
Oh, I don't want to be a nurse after this.
Well, that's okay. It's not suited for everybody, but the people who are well suited for it, they're an incredibly valuable job. Very, very, very important.
Thank you, all nurses and doctors of the world.
Exactly. Good stuff. All right, then we bring us into my third one here for disease management, healthcare administration. Have you ever met a healthcare administrator before?
I don't know.
You don't know. You probably don't know, and you don't run
I
into
don't know
those.
what that means.
When you're a patient, you might never see them. But so doctors are making decisions about your health. Nurses are doing things to help your health. The healthcare administrators are making the decisions about how can we make it easy for the doctors and nurses to do their jobs.
Oh, okay, that's pretty straightforward.
Yeah, they're making sure that there's plenty of supplies. PPE. That is a big, big, big word right now and during the pandemic. Do you know what PPE stands for?
Personal protective equipment?
Equipment, yeah. PPE. It's a fancy acronym for rubber gloves and face masks. You got it. So all the disposable stuff that you use to protect yourself, the doctors and nurses need it. When the nurse gives you that swab, the nurse will be wearing gloves. The nurse will have a face mask on. Nurse might even have disposable gown on as well too.
Scrub.
Or scrub. Yeah, exactly.
Scrub-a-dub-dub.
So that the healthcare administrator is making sure those supplies are available, and when they're running low, which is happening in some places right now, New York City for a time, and I think even now especially, is still low on some of these PPE equipment, which means doctors and nurses can't do their job safely. So the healthcare administrators are figuring out, where can I get more supplies? Who needs more supplies? Which supplies do they need? And getting all that organized. They also organize and help figure out when doctors and nurses need to be working and where they need to be working to be most effective. When somebody's sick, tell me, are they sick Monday through Friday from 9 in the morning until 5 in the afternoon?
No.
No, they're sick 24 hours a day, 7 days a week. Doctors and nurses need to be available to help them all around the clock. And the healthcare administrators are saying, okay, who are the right doctors to have in the hospital at what time? Who are the right nursing teams to have and where, especially when there's a surge in patients happening. So doctors and nurses have to do their job, and healthcare administrators try to do everything they can to make it easier for them to continue doing their job without problems.
Okay.
That brings me to my last point about these disease management roles or jobs. Cooperation, teamwork. It's all about that. Doctors, nurses, healthcare administrators, no single one of them is able to take care of a patient. It takes a whole group, a whole team all together. So it's another really big part of their job is they have to know how to communicate and work together as a team and as a unit. It's another major important skill in this job.
Okay.
All right?
Yeah.
So I hope now you're asking yourself, how do I become a doctor? How do I become a nurse? And let's talk about it. If I told you that it took a lot of education to get any of these jobs, would you be surprised?
No.
No.
I would not be surprised at all.
Yeah, it takes a lot of time to become an education, especially become a medical doctor. It takes a lot of school. They have to know all those things we just talked about, what's going on in the human body, all the different organs, and how drugs might interact or therapies might interact with all the things going on in the human body. That's a lot of stuff. So obviously, yes, they go to college first off and get a 4-year degree, like university. Do you think they have to study biology or medical science when they're doing that?
Yeah, I think so. Yeah, right? They should, right?
It makes sense, but actually, no, they don't have to. You could get your college degree in anything. I have several friends who are doctors. One has a degree in physics, one has a degree in chemistry, one has a degree in mathematics. Yeah.
I'm confused.
So just your 4-year degree for a doctor usually can be in almost anything, and then they decide later that they actually want to become a doctor, and they can apply to go to medical school, no matter what they studied in university. Then in medical school is where you really learn all the different medical facts that you need to know to put together and really start putting it all into practice. Having those different backgrounds of different university degrees is actually really advantageous. You get all kinds of doctors with lots of different specialties that way. All right? So they do need to study really hard to get into medical school. There's a big test. It's called an MCAT test. And
MCAT.
yeah, that test that covers a lot of biology, medical science, chemistry, physics. So even if you didn't study those things in school, you do have to know them well enough to pass that test. Medical school takes a long time, right? On top of regular 4-year degree. At that point in time, if you get past medical school, you are called a doctor. You get the title doctor.
Noise.
Yeah, that is nice. And after that, though, well, you start a job, usually called a residency, but it's still like a learning job, a training job. They're getting paid, and they work with a senior level specialist in whatever field they're interested in. So do you know it's like an apprenticeship. Do you know what an apprenticeship is? Or what an apprentice is?
It's like an assistant that learns from a person who is better at it.
Yeah, right, exactly. That was perfectly said. Well done. So they're doing an apprenticeship. They are trying to get a specialty in something. So if you were studying COVID-19 or other infectious diseases, you would be doing a residency with a pathologist, somebody who studies disease. And that's an expert on diseases. They know what it looks like for someone to get infected with the disease, how the body changes during the disease, and even some of the treatments that are involved in curing the disease. And they follow and track that sort of stuff. And so you might do that as a residency for several years before you become an independent doctor where you could practice pathology in your own clinic or with your own team at a hospital.
Yeah, sure.
All right. You got any questions about that?
I have a question.
Go ahead. Tell me.
Is pathologist related to pathogen? It's sort of like the word pathogen that we talked about in the last presentation.
Yes, good. I'm really proud of you for connecting those points. Yeah. So remember we said we like terminology in biology and in medicine. We love words, and especially Greek and Latin words. So we'll use those words to help explain what's happening here. Pathologist and pathogen are both derived from a Greek word, if I get this right, pathos. Pathos means, I think, suffering or experiencing something. So if somebody is suffering from, it implies that somebody's suffering from a disease. So the study of disease is a pathology. Someone who studies someone suffering from disease would be called a pathologist, and the organism that causes the disease is called a pathogen. So just that P-A-T-H, the P-A-T-H-O, patho part implies pathos, and if you know what that word means, the root word, then you can understand what all those other words mean.
Pathogen, pathologist, pathology, pathos, all related.
You got it. So good connection.
It's hard to remember.
Let's move on to nurse. So nurses also go to college. No surprise. The things that they're doing can cause life and death, right? They need to know exactly the techniques that they're doing. They need to do these tests properly, and they need to administer treatments properly. So there's no surprise. They really got to study what they're doing.
The whole life and death situation is kind of scary.
It is kind of scary. College degree is required. There are specialized nursing degrees that you could take, as opposed to like doctors who might be math major stuff. You can go to a 2-year school and get training specifically in nursing, and when you're done, be all ready to do a nursing job. There are different levels of training for nurses. So some nurses might go to school for 2 years, some might go to 4 years. I had a friend of mine who did biology with me in college for 4 years, and then decided he wanted to become a nurse after that. He went to nursing school for 1.5 years after that to finish it off. At the end, usually you have to pass a certification test. It kind of depends on the different states that people might work in as a nurse, but you have to definitely prove you know how to do all these techniques that you say you can do, because again, what did we just say? Life and death, right?
Mm-hmm.
Yeah, so
Scary.
Lots of education. You have to be very, very competent when you're doing your nursing job. Finally, healthcare administrator. They go to college as well.
So much college!
I know, right? They go to college as well. A lot of times
college get all the fun.
they have a lot of options too, kind of like, I guess, for a doctor. They can go to college degrees for lots of different subjects. Usually, though, they do have a medical science degree background because they kind of understand what's going on in the hospital. And then on top of that, often they will go to graduate school. So extra school after university, but not always necessarily medical school. And they can get something, business administration or a business applied degree is often in there because they're managing the hospital and doing a lot of business related tasks. So having that kind of experience is often very, very helpful. Sometimes they're doctors who've actually already got a medical degree and then they've managed to shift over more into the business side of things, which can involve even more school for them than what they've already got listed up here. So lots of flexibility in healthcare administration and the path that might get you there.
Okay.
Okay.
I like that. Good.
Excellent. Let's move on. Let's switch gears to a new set of careers. All right? They're researchers. They're also scientists. You listen to the news, they might say, scientists report this and scientists say that. They're talking about all these different researchers, and there's lots of different kinds of researchers. And so here's just a handful of them that I think are really pertinent to the COVID-19 pandemic.
Okay.
Number one, probably the most important right now, epidemiologist. It's a hard word to say, but what it essentially means, in my mind, is a disease detective. They're like Sherlock Holmes for diseases. They figure out what disease is happening, where it's happening, when it's happening, and if it's spreading somewhere. They can also suggest ways to prevent it from spreading too, because they understand what's causing it and what allows it to move from place to place.
Okay.
They generate this kind of data. This is a map of North Carolina where each of the counties is labeled for how many cases of COVID-19 that it has. The darker the blue, the more cases it has. The lighter the blue, the fewer cases it has. So that way the epidemiologists know where it's happening, when it's happening, and then they can help, like the healthcare administrators that we were just talking about in the previous slides, because they could say, oh no, there's a potential outbreak of a disease in this area, where they can notify those hospitals, those healthcare administrators before it happens, so they can prepare and make sure that the doctors and nurses have all the supplies they need to deal with it.
Alright. Oh yeah. So the white ones have like almost no cases, and the really dark blue ones, like that one that kind of has like a little tail on it right there, that one has like a lot of cases. It looks like the worst in North Carolina.
Yes, that's how it works. So all that data gets generated by the epidemiologists. And there'll be also like the bar charts you might see on the news that say, here's the number of new cases per day. Here's the number of new deaths per day. They're tracking all that information and telling us if more cases are occurring over time, or if we're getting control of it and it's starting to plateau, or even if we actually are finally starting to see a reduction in cases. And it's all their data that's able to help us understand that. Without them, we would have no idea. It'd be very difficult to get that broad, wide-ranging picture of how diseases are moving around. Another thing about epidemiologists that people forget is that they're working all the time. It's not just when these bad things are happening, like this pandemic. Every year we have flu, right?
Yeah.
Every year there's a flu season. Every year epidemiologists are out there collecting and digging through all the data on flu to understand where is flu happening most often and what strains of flu are moving around, and if there's any commonalities and outbreaks to try to prevent them from happening in the future. And even non-infectious diseases like cancer, they'll even track cancer and understand if there are blooms of cancer. Sometimes cancer occurs in geographic areas because of an unknown event. There might be something in the environment that's actually causing more people to have cancer, even though it's not infectious from one person to another. That's incredibly useful. And they might identify problems before hospitals and doctors are aware that more patients are occurring with a particular disease or pathology, right? So epidemiology, detectives, they're disease detectives. It's a very cool job. Then you got microbiologists and virologists. So I'm a microbiologist. A virologist is a specialized microbiologist who studies viruses, but there's a lot of overlap between those jobs. They are basically studying that organism intently, trying to learn everything there is about that organism. They also learn how to control it in a lab setting, which is really important because then we can design tests. And by designing tests, we can figure out all the little steps in their life. So this is a figure that I used in the previous presentation about virus basics, and I talk about the life cycle of a virus, so showing it getting into a host cell and coming back out after multiplying. You don't need to see all the details in this presentation, but all this work was generated basically by virologists and microbiologists, and this knowledge took decades for people to piece together all the experiments that helped make this whole picture. It seems kind of simple now, but when you can't directly observe this stuff, it's actually really difficult to do, and that's why it takes specialists in this field to be able to make this happen. Obviously, this is really important, right? If you want to learn how to prevent a virus from getting into a cell, you got to know how it binds and gets in the cell in the first place. Then you can learn how to interfere with it. Or if you want to make an antiviral that's going to prevent replication of a virus, you got to know how it replicates in the first place, right?
Yeah.
So this information is very, very important. Then you got biochemists and geneticists. I have them in here especially because they're very helpful in developing the diagnostic tests that we're currently using. This was also in a previous video, though, in the COVID-19 video, where we talked about testing, how we're doing the testing with the nasal swabs and the RT-PCR test.
Yeah.
Well, that requires you to sequence the genetic material of the virus.
Huh.
So sequencing and genetics, that's what a geneticist does. So they're the ones who figured out the sequence of SARS-CoV-2, and then that information can be used by biochemists and geneticists to make the primers that then probe for the virus, this test right here. Without the genetic information from the geneticist, you wouldn't be able to design a test. And then that test is being used to generate the data that the epidemiologists use to create these maps. So you see how all this stuff gets connected from one to another?
Sorta, yes.
Sort of. So all this stuff works so that we can predict disease, identify disease, and ultimately treat disease. So here's the slide reiterating exactly what I just said. There's overlap among all these jobs. You don't just have to be an epidemiologist. You can be a microbiologist and an epidemiologist. You don't have to just be a geneticist. You can be a geneticist and a microbiologist. Usually people have training in all this stuff. When I'm being really formal about my job title and kind of braggy about it, I'll tell someone that I'm a molecular microbiologist and geneticist, because I feel very comfortable with molecular biology, microbiology, and genetics. So you never have to really be boxed into one of these particular job roles. There's a lot of flexibility here.
So how do you become one of these researchers?
That's a good question. Perfectly right on time. Remember how those previous medical jobs involved quite a bit of school?
Yeah.
These are exactly the same way. It's also a whole bunch of school.
So much school involved.
Exactly. So
I love it.
I've already mentioned, I'm a microbiologist. And so I went to college for 4 years and I majored in biology. You can major in all kinds of different sciences. Depends on what kind of researcher you want to be. Of course, we're talking kind of about the virus-related sort of things.
Yeah.
So I did biology, and a lot of people who want to study viruses would do that too. So 4 years of college there, and then after it, I went to graduate school, which is extra college. It's optional school after the main 4 years of college.
So you need to get the college degree if you want to be one of these things.
Yeah. In order to get to graduate school, or even medical school, or a lot of those other advanced schools, they expect you to have a college degree. So you got to get that in, of course. So then that's why it's important to do well in elementary school and middle school and high school, so that way you can get into college. It kind of opens up new levels. It's like a video game, right? You pass one level, and then it unlocks the next level, and then you can get into it. Yeah, just like that. So college degree unlocks graduate school, and then there's different levels of graduate work. They have master's degrees and they have doctoral degrees. Master's degrees are considered, easy isn't the right word. Maybe the requirements are not quite as strenuous as a doctoral degree. I skipped my master's degree. I didn't get a master's degree. I went straight in and got a doctoral degree, so I was in school for 6 years. So that's the other thing to keep in mind. Some people go college degree, master's degree, doctoral degree, but you can go straight into a doctoral degree. You just know you're going to be at school usually for a lot longer. So master's degree can be done in 2 years, sometimes 1 year. It depends on the project that you do while you're there. Doctoral degree, mine was just shy of 6 years. Some are even longer than that, and some can be shorter, but usually it requires a good bit of time. And then remember we were talking about medical school, we were talking about becoming a doctor, and they go and do a residency, which is like an apprenticeship.
Mm-hmm.
They also do that here for if you get a doctoral degree. Often your first position after getting your doctorate is called a postdoctoral position. meaning after doctorate work. And it's a job kind of like a residency, but not the full-on job. You're still training with an expert, a master who's already got. So I did a postdoctoral degree with a scientist who already had her PhD and a whole lot of experience. And I worked with her for about 3 years, and I learned a whole lot of extra new skills. And it wasn't until I finished college for 4 years, my doctorate in 6 years, and my postdoctoral work in another 3 years. So what are we up to now?
13.
13 years. So after 13 years, after I finished high school, then I was ready to actually finally get a job doing microbiology.
So that takes up most of your entire life.
Well, I guess it's now at this point it's about a third of my life. But yeah, it was a lot. It's a lot. But that's okay because it's your career, right?
Yeah.
It's my whole future. It's what I'd want to do for the rest of my life. So I want to get lots of practice and training in. If there's something you really want to do, right? Like if you want to be a world-class soccer player. Or an inventor. You got to put in time to do things. You got to learn how to invent things. You got to learn how to play the sport. You got to learn how to do it. So this is what this is all about. Again, it's like a video game. You keep advancing in levels and getting better and better and more skilled. I think it's fun. So if you like school, this is a good option. The other thing though to keep in mind is
school.
Good. The other thing I want to mention too is that for a lot of these jobs, you don't have to do all this graduate work stuff at all. A lot of people, most of the people I work with have the college degree in various fields, chemistry and biology and biochemistry, but they are doing microbiology work and geneticist work, and we're working together in the lab. It's just at my position, I have a team of people who have master's degrees and college degrees that I help kind of mentor as they're doing the job. But we all work together in a team. There's a lot of times when one of them knows way more about something than I do, and so they're teaching me. But we all work together. So you don't have to go to school for all these years, and you don't have to do it all in a row either. You can get a college degree, then go work a job, and then decide later. I know a lot of people do that. Decide later they want to go back to school to get a little bit more experience in something, to maybe unlock that next level, right, in their job. And you can take breaks in between these. There's no reason you have to do it in this order all at once.
So you could go college degree, doctoral degree, master's degree, and then postdoctoral work?
I guess you could. Like you could get a college degree and then get a PhD like I did, and then you could get a master's degree maybe in a different field. Sure, absolutely. If you want to do that, you could. Usually a postdoctoral position is done right after your doctorate. Usually. But no, I bet any of those things are possible. Any other questions about this? Does it make sense?
Makes sense.
Makes sense. And this is true for just about any science-based kind of research, not just the stuff related to virology that we're kind of talking about now. If you're going to be a chemist, this is very common. You want to be an astronomer, this is the kind of thing that go, or psychiatrist, and psychologists. All those jobs where you think about somebody who's doing science and working in a lab and doing research, this is kind of the basic outline. All right?
That's cool.
Cool. All right, so now we're on the very last group of science-related jobs that have something to do with this virus pandemic. And we got science communicators. That's the big group that I have them all lumped into. Science policy advisors and science writers are the examples I have. Most people don't really think about these jobs when they think of people who do science, but there are a lot of these jobs out there. Do you know what a science policy advisor is?
No.
No, you don't know what it is. I'm not surprised. I didn't know what a science policy advisor was until I was in my postdoctoral position. We were just talking about that.
The apprenticeship.
The apprenticeship. That's when I met somebody who was a science policy advisor. I found out what they did. I thought it was neat. They actually suggested I apply for that job.
Oh.
And I did. I applied to work as a science policy advisor in the White House.
Whoa.
Many, many years ago. And I learned a lot about the position and what's involved with it. In order to do that application, I did not get that job.
Aww.
It's okay. It's fine. I'm not upset about that at all. I learned a lot from the whole process. And so what it is we have politicians and government leaders who help dictate what laws and regulations and choices are made to help keep our society safe, right?
Yeah.
Okay, so running the whole United States, of course, you've got the President of the United States is a big person. You also have Congress, who's helping to run what's going on in a country. And then at a slightly lower level, on the state level, we also have our governors and their legislative bodies that decide laws for the states. Right now, in this COVID-19 pandemic, the governors have a huge amount of power in what's happening, and every single state has its own rules in effect for how to keep its population safe, right? So sometimes we're wearing face masks to go to hair salons and to go to any public event, really. And right now, and a lot of things are closed, have been closed, like bowling alleys and movie theaters, and they're dictating what jobs are essential, what jobs aren't essential, and the federal government is putting out money and assistance to help people pay for rent and mortgages when they might be out of work for a while, and all these things are going on. All these choices are being made on a political level that have huge impacts on people because of a biological thing.
Wow.
Because of a medical risk. But most of these politicians are not trained as scientists. Most of them probably didn't get any more science than most folks get going through primary school. So they need to know what they're talking about to make all those big, heavy choices. And that's when they lead on their advisors. And they specifically have a group of advisors called science policy advisors. That's what their job is. They are scientists, they are doctors, they are engineers, they're people who understand STEAM concepts, which you guys know about being in school, right? Science, technology, art, engineering, mathematics. They understand those concepts, and they're the advisor, and they go to the president and say, here's what we know about this virus. Here's how it works. Here's how it spreads. And they go to the governors and say, here's the epidemiology in your state. Here's where your cases are heaviest. And they show them all those maps, and they show them of where the virus is spread and where outbreaks are occurring. And they show them how the virus replication cycle works. And they do all that information so that the politicians can make the best choices to keep everybody safe. Because they don't have the time to learn this stuff from scratch. They need someone who's an expert to already catch them up on it. Does that make sense?
Okay.
That's what science policy advisors do. And here's a list of a lot of the big topics that they've been involved with. Infectious disease is a big one right now. But in addition to that, you got antibiotic resistance has been a very big topic for many years. Climate change has been a very big topic for many years. Cybersecurity, information technology. Those are the kinds of things policy advisors are doing. It's a big job, and they're having to communicate with the people who decide how our country works. It's neat. Then there's science writers. Science writers are also communicating the same concepts that we were just talking about, but their main focus is communicating it to the public, to everybody that's out there. Us reading newspapers, magazines, websites, posting boards on when we're scrolling through even social media to some degree. You're seeing more and more stuff being written by science writers. So these are people who are like a journalist. They're writing for a website or for a newspaper company, and their expertise is they're good writers. They're also specialists or have good knowledge of different fields of science. So there's somebody who does infectious disease science writing, and I tell you right now, those people are writing tons of articles because they're trying to explain to us as the public why we need to wear face masks. Oh, the governor said you got to wear a face mask, and some people get upset about that. The science writer is then going to be like, here's why they should do that. And they try to simplify these complicated biological concepts to things that people understand better. Like I said in a previous video, you hear about R0 values for epidemiology and infection rates and outbreaks and all these sciencey words in the news. And what the news needs to do is make sure that everybody, even if you haven't learned about science, understands those concepts. That's their job.
Cool.
They get to write, research, and understand these scientific concepts and communicate them out to people. They conduct interviews with scientists so they understand the research that's being done. Right now, everyone wants to know, is there a vaccine? Is there a vaccine? Is there a vaccine? And so people are calling up scientists, and they're calling up the companies that they work for, say, explain to me what you're doing, where you are with this trial and with that trial. And it's up to the science writer to understand what it means to be in a phase 2 clinical trial, or a safety efficacy trial, or any of these other different terms, or well, safety trial and efficacy trial are separate. I misspoke. But anyway, they've got to understand those concepts and communicate it so that people understand just how far along this process is. And they also get to go to conferences and document them when conferences happen. There are less right now, but I'm sure it's going to pick up for virtual conferences. It's a cool job.
Sounds like it.
We're doing science writing right now while we're recording these videos.
Really?
We're communicating to people what these ideas and what these concepts are. We have some experience with it, and we're trying to share that experience. And this is one way to communicating. We're not writing a newspaper article. I keep saying newspapers, but hardly anybody reads newspapers anymore. We're not writing a website post. We're not writing for a major news outlet. We're just making a video that we hope can be shared with folks. Right?
Mm-hmm.
It's cool. You can make a whole career out of this.
Cool.
So these jobs are really important because it's how most people get their scientific knowledge right now. People pay more attention when something they care about is happening, and so people care more about science when something science related is impacting their everyday life, like COVID-19 is right now.
Okay.
Yep, more people are going to be learning about virology at this moment in time than they probably will in their entire life, and the science communicators are the ones who are responsible for it. They have a really big impact in what's going on.
Wow.
So, are you interested in how to become a science communicator?
Yeah.
Well, you already know one way, because you ended up doing this with me in the video. Sometimes just being in the right place at the right time and knowing the right people can help you to some degree.
Cool.
Cool. But on a practical level, how do you become a science policy advisor? This one might actually be the hardest one out of all of them that we've talked about, because there isn't a program that you necessarily go to, like in college, to do science policy. Now the job that I applied to was just an opportunity to do science policy. And at that point in time, they already expected me to have a lot of experience. I already had a doctoral degree by that point in time. So usually science policy advisors actually have a lot of experience when they go into it. They already have somewhat of a career in science. So a lot of the things we already talked about, like becoming a medical doctor or getting a degree and knowledge in science or STEM related field, is required to do it. And once you've had a decently pretty good career to some degree, then that's when people are going to be looking at you and be like saying, hey, you're an expert. You know what you're talking about. I want you to come over and tell me about what's important with these topics so that we can make some good choices. So here I've got it listed. I mean, in order to be at that level of experience, you're going to have a science or technology degree. You probably need an advanced degree. That's like those master's and PhD things. And it could also help to have a political science degree or some sort of experience in politics as well. And that was the part when I applied to do this job where I was lacking. I didn't really have much. And when I got rejected for the job, that's what they told me, was that I didn't really have a whole lot of political experience.
Well, I can kind of agree. I can kind of see why they did that.
That's fine, yeah. Totally fine with me. Yeah. But, I got more experience by applying for the job. So in hindsight, I'm still very glad that I did it. Getting rejected is not the worst thing that's ever happened to me. So it takes a lot of time to do this kind of job, but it's a neat one. And again, most people don't even realize it's out there. So now, science writer. This one is cool because there's actually kind of multiple ways to end up becoming a science writer. There are two main paths. And I know people who have done both of these things. One of them is you could go to school, get a degree in science, and then learn how to write really well and how to do journalism.
Okay.
The other way, of course, is to go and get a journalism experience or a journalism degree, which you can get, and basically how to communicate. And then after that, you learn the science you need to focus on it. Sometimes it's like people get a journalism degree as a major when they're in school.
So you have to learn both things?
Yeah. Usually, you have to learn it at some point in some way.
You just have to do it in either order, though.
You could do it in either order. You got it. So I know people who went and got a major in journalism and communication. So that was what their primary focus was when they were in school. And then they have these things called a minor, where you take a lot of classes in a subject, but not enough to get a degree in that subject. So I knew someone who majored in journalism and minored in biology. And now she works as a writer for a website. So she knows a lot about biology. She didn't take as much as I did, but she took a lot of science classes so she was comfortable with those science topics. Then when her editor wants her to write a report about COVID-19, she already knows a lot of that knowledge, and she knows the people to ask. Like, she can write me an email and say, hey, would you mind explaining this concept to me? And I'm like, yeah, no problem. And I already know her, so she has that connection. That's what science writers will do. So anyway, science degree or learn journalism, or journalism degree and learn science, or certainly you could do both if you wanted to do that too. There are a few programs that focus specifically on science writing. Again, when I was in my postdoctoral position, I took a class with it was the National Cancer Institute. I took a class at the National Cancer Institute, um, and focused on science writing. So that was a lot of fun. So there are opportunities like that too as you get into those advanced levels of education. And this is an area that's growing, right? Because more and more people are connected now than ever before, especially through the internet. And this communication, people go straight to the internet to find out things. They go straight to YouTube, right, to see a video. They go straight to a website to read something. And these people, the science writers, are the ones who are putting that content out there. And so there's a lot of opportunities. Do these two jobs kind of make sense?
More sense than I understood at first.
Do you have any questions about them?
No, not really.
All right, well then we'll call it good. So, like good science communicators, let's circle back around to where we started. I already had this slide up before, except with these arrows and boxes. I've added those in now. So what was going on? We got currently an active pandemic. There's something that's infectious going around the world. We like to call it SARS-CoV-2. It's causing COVID-19. People are getting sick with COVID-19. And what are our problems that we need to deal with for them? Hospitals need to treat the sick. Science needs to understand the disease and try to invent therapies for it. Governments need to protect the public, and people need to protect themselves and the people that they love. Who are doing the jobs to help all that stuff happen? Doctors, nurses, and healthcare administrators. They're responsible for really treating most of the sick people, right? Mm-hmm. Very important. Virologists, epidemiologists, geneticists, and a lot of other scientists on top of that, they're the ones researching the disease in the lab, figuring out how to treat it, what drugs might help. Makes sense. Governments, they need to protect the public because they're making those laws that change our everyday lives, like closing schools right now, or at least closing the buildings. We're still doing school. Yeah. So science policy advisors, researchers, also I got doctors in here as well too, because they're also having a big influence on talking with governments as well too, and helping our governors and president make those choices. Very, very, very important jobs. And lastly, but probably the most conspicuous, the ones that are most obvious to the people on a day-to-day occurrence, is how they're getting their science communicated to them. And the science writers and the science policy advisors are responsible for that, saying, here's the problem, here's what's going on, here's what we need to do, here's why it matters.
Okay, I understand.
Excellent. So that concludes our deep dive into careers and jobs related with the COVID-19 pandemic. None of these jobs are new. All these jobs existed way before the pandemic happened, and they've been around for hundreds of years. Microbiology started in the 1800s with Louis Pasteur in France. So these jobs have been around for a long while, and they will continue to be around after this has happened. Issues in the medical community, in the health community, in the microbiology community have been occurring every single day, every single week, every single month of every single year for as long as I'm aware of. So there are always good opportunities out there. If these things are interesting to you, then there are all these possible routes that we talked about where you can learn this information and build a whole career out of it. And I know I'm very biased, but I think it is very rewarding. So I hoped it was educational, and I really enjoyed talking about it with you. And I look forward to the next time we get to discuss a cool science topic. Take care.